So here it is. I wake up paralyzed from the neck on down. It's a temporary paralysis, but I couldn't move, I couldn't talk. And later on it did wear off. And then I went through the period of 1 year of misdiagnosis and everyone trying to figure out what was wrong with me. In my late 20s, they diagnosed me with chronic fatigue syndrome. I was awake 3 or 4 hours a day. Irritable bowel syndrome, I forgot, that was another big one. Chronic fatigue syndrome, irritable bowel syndrome, fibromyalgia, multiple chemical sensitivity, lupus. They had also played around with me having ALS or Lou Gehrig's disease, and at one point they thought I had MS or multiple sclerosis.
If you do get a tick bite, there's no recommendation that you should come in to a physician to get treatment prophylactically to prevent Lyme disease. You just have to wait and see if you develop symptoms and you need treatment.
Well, it started years ago. I can go back as far as when I was a young kid, about 10 or 12 years old. We'd just come back from a vacation to Florida, and we'd camped all the way down and all the way back. And I had several tick bites, and I came down with a very high fever.
Stage 1 is when the actual tick bite occurs, and what you typically see is a rash, and that is just like a reddened erythematous lesion. It can have a central area which can get necrotic, typically not. And then as it enlarges, you can see multiple rings of redness around it with a little bit of central clearing, also referred to as a bullseye kind of rash.
We don't really remember a rash of any kind, but through the years I had chronic bronchitis, sinusitis infections, pleurisy.
In addition to skin rash, it can also manifest with heart problems.
But I had hallucinations. I would have electrical shock feelings go through my body. My body was on fire for 4 days in a row at one point.
And then it can, if it's untreated, it can progress on to what's called a latent stage. And that typically occurs months to years into the illness if it's untreated.
Myself, they started me off with some oral antibiotics. I'd been untreated for probably 30 years at that point. And over time they realized that they had to put me on IV antibiotics. The first course was for 3 months.
Typically what's recommended is 40 to 21 days for any form of Lyme disease other than CNS disease. Some physicians prefer treating for longer, like patients can have ongoing symptoms even at the end of therapy, and you can treat them with another course, but really there's no recommendations for prolonged treatments for months and months of antibiotics.
Then about 2 years later, because I kept declining on oral medication, antibiotics, they put me back on IV antibiotics. This time it was for 16 months.
If someone keeps having symptoms, you keep checking the labs. You don't keep treating them over and over unless there is indication that they've been reinfected, if you have, again, a good history and a good exam to support your judgment.
Lyme disease is treatable in most cases if it's caught early enough.
It's not contagious from person to person. It is a vector-borne disease, so it's the ticks which are infecting the humans. Humans don't give it to other humans. There have been few reports of mothers transmitting it to children during pregnancy, but that's again very few reported cases. But it's not contagious within a family or so. Again, if the whole family's been out and have had the same exposures, more than one member of the family can get it, but a mom will not be giving it to her children.
Actually, well, I know people have actually died from Lyme disease, so yeah, it can be fatal.